Good afternoon. Good afternoon, ladies and gentlemen. We're going to go ahead and get started because I have the sense that everybody's ready to get to the networking portion. No fault of your own. Well, good afternoon, ladies and gentlemen. Just to close out, I want to take a moment and just thank each and every one of you all for being here. You know, this event continues to grow, and I think it's a testament to not only our employees' dedication to innovation, but also to each and every one of you who doesn't work for the VA, whether you're from academia and industry, your commitment to us. So it really means a lot to us that more and more people are coming to this event. It tells us we're doing something right, but I think it also tells us that this mission is incredibly important to each and every one of you. We're going to proceed with our award ceremony. We've got a number of special awards, but one truly special award. For the first time, VHA is going to award the Innovator of the Year. And so something we're looking very forward to. I won't ruin additional surprises about that award, but something that's going to mean a lot to us moving forward. So the first thing I do want to do is introduce to you our leader, the leader that we look to for guidance in a new office, the Office of Discovery, Education, and Affiliate Networks. Now, I mentioned this a day or two ago that the modernization efforts underway in VA have now taken the Office of Research Development, the Office of Academic Affiliations, and this new program, the Innovation Ecosystem, under one umbrella. And I think that is a statement, and it's also going to provide incredible amount of synergy for what research and innovation, what we can do with our academic partners. It's a true step forward in modernization, and I could think of no one better than Dr. Carolyn Clancy to lead that office. Dr. Clancy has an incredibly established career. She ran the Agency for Healthcare Research for over a decade, has served in numerous positions in the VA, including as the interim undersecretary, so has seen the organization from both outside and within from the highest levels. And without further ado, please welcome Dr. Carolyn Clancy.
Well, thank you very much, Dr. Vega. I understand it's gotten a little crowded in here the past couple of days, which is a great thing. And it's fabulous for me to see how many people are excited about the many different ways we can do an even better job providing care to veterans. So as Ryan said, I am the Deputy Undersecretary for Health for Discovery, Education, and Affiliate Networks. In my view, that makes me the Dean. And I want to personally thank all of you for your participation in the 2019 VHA Innovation Experience. I just hope the press club recovers, but we can get there later. And either people who were here directly, of course, but also people participating in the live feed. I will tell you that one of my senior colleagues came over here yesterday to hear one presentation, and there she is, Dr. Ann Utek. Raise your hand. Now the Acting Director of Specialty Care returned home, or maybe from here, sent an email to all her colleagues in the field saying, you too can see the live feeds of these presentations and so forth. And I'm going to guess that many other people were doing exactly the same thing. So the innovation ecosystem is just a year old. We will not be having a birthday cake today, but it continues to mature and advance. And one of the examples of this is the establishment of the Innovation Ecosystem Fellowship Program. I'm going to guess that many of you have noticed that many of our academic partners have people doing innovation. Now, it gets a little bit hard because their context is very different, right? And what I've finally learned after doing a fair amount of reading is that somewhere in there is the notion of a new revenue stream, which is not precisely how we're thinking about things. But it is clearly a time when people appreciate the great potential to learn from the people who actually do the work, how we can do it even better. So we've also launched this past year the Entrepreneur in Residence and Senior Innovation Fellowship programs, and wow, what an added value they have both been, to provide a unique opportunity for professionals to gain the experience and skills necessary to develop and scale an emerging innovation. I'm hoping and guessing that many of you heard about innovations that were like, wow, Why didn't we think of this? We could do this too, right? But we've got to figure out how to speed up that cycle. Not so we in central office can send more memos, do not get me wrong, but more because there's just so much to learn, and there are so many good solutions that are out there just in our own system that we could all be taking advantage of. So the year-long program for the Entrepreneur in Residence and Senior Innovation Fellow allow individuals to become change agents and catalytic leaders at their local institutions while working on transformational projects. Having worked with both of them, I can't even begin to tell you how transformational they are. So I really want to acknowledge the contributions of both Suzanne Shirley, where is she? You can tell I have my glasses on. Yes, Susie Shirley. Among many accomplishments, running this amazing hackathon right here in the nation's capital, and helping people like me saying, what is a hackathon, really catch the wave and understand just how important it was. It was very, very exciting. And Beth Ripley, who was serving as our Senior Innovation Fellow. So those of you who got to hear any of Beth's presentations here or elsewhere on the power of 3D printing will know exactly what I mean. For me, the peak experience this year was there was a decision to have an innovation fair, which was originally supposed to be held at the White House. I can only say with all the equipment necessary, this would have not been a really good idea. Instead, it was held at the Department of Labor, which does have, for reasons unclear to me, a huge amount of open space on their first floor. So that was much better suited for our folks with very large equipment for virtual reality to help veterans with PTSD, for the PTSD models, for the 3D models, and so forth. And of course, a whole lot of computer screens and so forth. My personal favorite there, by the way, was somebody at, I think the CDC, created a special app, which is Waze for Lyme disease. And what you do is, if you're out walking or hiking, and you've got your phone with you, of course, you would not leave home without it, and you see a tick, you tap your app and let them know, you know, on this tree I saw 2 ticks. And that's how they populate maps. I haven't figured out if this is working yet, but it's, you'll get the analogy to Waze. But really, Beth Ripley's work was really a big, big centerpiece. So this year, we're excited to announce that we'll have 2 entrepreneurs in residence. First, we want to recognize and welcome to the stage Danielle Kakora from the VA Northeast Ohio Health System. So her Makeathons project brings together problem solvers from different sectors to build technical solutions for the unmet needs of injured veterans. So now we're going to take a photo, and since this is VA, it'll be right in front of a flag. So the second Entrepreneur in Residence Fellow, and by the way, these are not, these are just in order here, not anything else, is Dr. G. Eli Kaufman from VA Puget Sound Healthcare System, and whose project Mobile Orthotic and Prosthetic Services provides VA clinical prosthetic care at the location of the veteran's choosing. Imagine that, right? You don't have to come to us. I happened to visit the lab at Puget Sound, and all I can say is, wow. First, they were whining about being in the basement, but understand they're in a basement with windows, and I don't mean like those little tiny square things. I mean like walls of glass where they too can see Mount Rainier. So it is a lovely, lovely space. And the Senior Innovation Fellow Program, okay, which allows accomplished VHA leaders with a dynamic presence, passion for innovation, and vision for a future opportunity to gain the experience and skills necessary to lead a large-scale innovation as it's implemented throughout the enterprise. So this is a year-long training program, hands-on training in the core competencies of an innovation fellow to diffuse a large-scale innovation through the ecosystem. Now, you can probably tell I have a very thoughtfully written script, which we've gone over many, many times. But what I will say is the words roll right off the tongue. Actually, the work is pretty challenging because this is a code that just about every healthcare system in the country is trying to crack, and we're going to crack it first. So the Senior Innovation Fellow we want to recognize and welcome to the stage is Amanda Purnell, an Innovation Specialist Program. She's an innovation specialist from VA St. Louis Healthcare System, part of the National Team for Human-Centered Design Training. She has coordinated several national spread projects. More than 1,000 staff across the country have attended human-centered design trainings at this facility, and Amanda will lead work focused on the further use of the big data to advance innovation efforts across the enterprise. Congratulations. You knew I would work that in somewhere. So during this award ceremony, my fellow VHA leaders and I also want to recognize the top innovators from the healthcare system and present the awards and results of the 2019 Shark Tank competition, the VHA Innovation Experience Poster Award, the VHA Innovation Experience Demo Awards, and the Innovator of the Year Award in remembrance of Dr. Robert Jessee, former Principal Deputy Undersecretary for Health. So to kick us off, I'm going to call Mr. Blake Henderson, the Acting Director of Diffusion of Excellence in the VHA Innovation Ecosystem, to present the highly anticipated, no one knows till this very moment, 2019 VHA Shark Tank competition results. Mr. Henderson.
Thank you, Dr. Clancy. So this is our 5th Shark Tank competition and our 2nd year hosting it here at the Press Club. And for those who attended last year and remember some of the audio problems, this is the first year I didn't want to hide behind one of those flags or banners. It's nothing like getting put on hold by a medical center in front of 200 people to really be humbling. So a few numbers before I dive into the gold status practice announcements. We had 591 applications submitted this year, which culminated in 15 incredible finalist pitches yesterday. I'm so proud of the effort you all put into that. Thank you all. Which culminated in 37 great bids from sharks across the country, as well as over 800 popular votes submitted by our employees. So today we're going to announce 15 implementing facilities, and we're going to award the gold status practice designation to 12 practices. So once I announce the name of your practice, please come on up here, and we'll group everybody up here on the stage. Our first gold status practice is a whole health approach for reducing opioid reliance and utilization, developed by Mike Moats. Where are you, Mike? Go see kid over there. So this practice will be implemented at VA Boston Healthcare System, which has a really pronounced need for this. Our second gold status practice is Environmental Services Dedicated Training Specialist, developed by Tammy Splitstoser. This practice was in extremely high demand and will be implemented at VA Northeast Ohio Healthcare System and Birmingham VA Medical Center. Our third gold status practice is fall boot camp for veterans suffering from Parkinson's disease. Developed by Rebecca Hayden, this practice will be implemented at VA Roseburg Healthcare System and Tennessee Valley Healthcare System. All right, so our fourth, I got to work on my tempo. Our fourth gold status practice is Jerry Vet, developed by Jill Houdet. Jerry Vet will be implemented at Memphis VA Medical Center. Our fifth gold status practice and getting second on the popular vote is Healthier Kidneys Through Your Kitchen. Developed by Rebecca Schluter, this practice will be implemented at Salisbury VA Medical Center and Martinsburg VA Medical Center. Our sixth gold status practice is One Consult Pathway, developed by Jeffrey Hunderdietz. This practice will be implemented at VA Eastern Kansas Healthcare System. Our seventh gold status practice is Pre-Operative Frailty Screening and Prehab, developed by Danielle Hall. This practice will be implemented at Iowa City VA Healthcare System. Our eighth gold status practice is Suicide Alert Red Card, developed by Jeanette Salvaggio. This practice will be implemented at Tuscaloosa VA Medical Center. Our ninth gold status practice is teledentistry using Store and Ford technology. Developed by Lisa Heck, this practice will be implemented at Gulf Coast Veterans Healthcare System. Our 10th gold status practice is Telerehab Wheeled Mobility Clinic, developed by Jessica Holland. This practice will be implemented at Malcolm Randall VA Medical Center, North Florida, South Georgia Veterans Healthcare System. Our 11th gold status practice is Virtual Claims Clinic Program, developed by Andrea Hill. Okay, this practice will be implemented at Carl Vinson VA Medical Center. Okay. As many of you, I think, know, this is our first year that we incorporated the popular vote. Our 12th and final gold status practice, winning over 250 votes from employees, is Veterans Mental Evaluation Team by Shannon Teague. So, congratulations to all our finalists. We'll be looking forward to working with you in the coming year and to seeing you at base camp in New Orleans in February of 2020. So, thank you, everybody.
forward, and then here's the demos. And I'll hand you the awards as they come.
Okay. Well, congratulations again to the VHA Shark Tank competition winners. I'm excited to follow your journeys. And amazed and thrilled by what you came up with. So this is just amazing. As we continue to recognize exciting accomplishments in innovation, the VHA Innovation Experience Poster Award recognizes the most innovative poster presentation from the poster exhibits here. Over the past 2 days, you saw 24 innovation posters and voted for your favorite new approaches to current challenges impacting our veterans. To those who submitted poster presentations this year, thank you for your continued exploration into new innovations and your forward-thinking approach to caring for veterans, and don't stop now. However, it is my honor to present the VHA Innovation Experience Poster Award winner, selected by popular vote, to Electronic Controlled Substance Prescription Tool. Are they here? Come on down. Yeah. This is it. Where's my guy? And now we move on to the VHA Innovation Experience Demo Awards. These recognize the top practice demos from the clinical and innovation, health enabling technology, and innovative research demo tracks. That is a mouthful. Evaluators representing both the public and private sectors assessed each demo for its innovative approach to an identified problem, positive impact through data collection, improved satisfaction of the target population, and the overall presenter's ability to create interest among audience members. I hope this didn't include just junk food at the displays, but we can talk about that later. To all who submitted demos, you did not give the evaluators an easy job this year. Each of you offered new approaches to making a positive impact for our veterans, and thank you for your participation. So, the VHA Innovation Experience Demo Award for Clinical Innovation Demo Track is presented today to Adam Gold from the Martinsburg VA. And his project is Dominating Diabetes, DOM in capital letters. And is he coming down? Yes. Okay. I thought maybe he might like jump into the mosh pit, but I think that would have been a little dangerous. Well, while he is making his way, the VHA Innovation Experience Demo Award for the Health Enabling Technology Demo Track is presented today to Sabrina Renee Butler. From John McClellan Hospital, Veterans Hospital, with the Shoe Slide Project. You have to have your picture taken. Not optional. Congratulations. All right. And the final demo award for the Innovative Research Demo Track is presented today to Sarah Landis from Central Arkansas Veterans Healthcare System with the Caring Contacts for Suicide Prevention Project. And now, for the great suspense, we did save the best for last. This is the Dr. Robert Jessee Award for Excellence in Innovation finalists and Innovator of the Year Award. I want to invite Bob Jessee's family to the stage. So to my immediate right is Bob's wife, Janice. A little-known secret is that I taught Janice as a medical student, which, to be quite honest, I'd forgotten altogether till Bob reminded me. But I do remember the month. It was an unusual period when we had all-women team. It was great. And his daughter, Amber, is standing next to her. She's now working for Facebook, and she knows everything about all of you. So I just had to say that, Amber. So this award was established to honor Dr. Jessee, who was appointed Principal Deputy Undersecretary for Health, or as we say, the PDUSH, in the Department of Veterans Affairs on July 4th, 2010. Prior to that appointment, Dr. Jessee had served as the acting Principal Deputy Undersecretary for Health for 4 months. He was also the Chief Consultant for Medical Surgical Services, Inpatient Care Services, and served as the National Program Director for Cardiology. I first met Bob, by the way, when we both served on the board together of the Patient-Centered Outcomes Research Institute, and it became clear to me almost immediately that he was without question, the most visionary member of the board, which was not actually a high bar at that point in time, but he was just way ahead of everyone else's thinking, and it was really such a thrill to work with him that he really inspired me to come to VA several years later. But one of the things I remember him telling me was that as part of his work being the National Cardiology Program Director was he had to do the heavy lifting of figuring out how many emergency rooms we actually had in the system. Now, at this point, when he shared that vital piece of information, I was halfway through the VetPro process, right? So when I remember thinking, I wonder if I made a mistake. You mean you had to do a survey to, but yes, that was the case. But by God, they got the right number. But in that capacity, he implemented broad reforms in the delivery of specialty, subspecialty, and emergency care that led to significant and sustained improvements in care quality across our healthcare system. His vision, his commitment, and dedication to innovation were noteworthy during his tenure at VA. Since I reported directly to Bob when I first came here, I mean, this was a thrill because it was like a weekly vision meeting. And, you know, Bob could see what was coming down the pike 5 or 10 years down ahead of time. And I kept looking around his office, like, where is that crystal ball? But he just had that kind of vision and inspired it in so many others. As I recall, Janice, he also had a whiteboard in his office with listings of other people's projects, some of which I didn't understand, but I listened carefully, so I deciphered a few. But that was just the kind of visionary that he was, just an amazing, amazing man, totally dedicated to caring for our veterans. The Innovator of the Year Award recognizes and honors VA and VHA employees who've demonstrated excellence and enabled the discovery and spread of healthcare innovation that exceeds expectation, restores hope, and builds trust. Each one of the finalists have implemented creative and innovative approaches to promote health improvements across the enterprise in support of mission-driven innovation. They have a vision, and they have personally been a catalyst for the advancement of care delivery and service. These finalists have also collaborated with their community by establishing relationships with non-VA counterparts and with other healthcare colleagues and frontline staff, and are recognized as someone who exemplifies the ability to build relationships with others through trust, respect, and knowledge of innovation principles. So these are not eggheads sitting in an ivory tower, okay? These are people who are inspiring others, because you can't actually inspire people to follow you and to make change without that. Finally, the finalists have developed and effectively replicated an innovative process or solution that has positively impacted veterans' care. So we'd like to acknowledge our first finalist for the Dr. Robert Jessee Award for Excellence in Innovation, and that's Dr. Kathy Frisbee. Dr. Frisbee is the Executive Director of Connected Care in VHA's Office of Connected Care, and she works to transform healthcare delivery at VA by developing virtual care solutions that extend the reach of VA healthcare beyond traditional face-to-face visits. Also another example of, seeing the future. Her vision has driven a wide variety of new health technology solutions that directly benefit veterans, and she's pushed VA forward on many fronts, including the successful implementation and transition to one of VA's first cloud-hosted mobile application environments. Many of the mobile health apps she's helped advance are groundbreaking in their capabilities. VA Video Connect, VA Online Scheduling, and the Annie text messaging app, just as some examples. During Dr. Frisbee's tenure, and as a result of her direction, more than 4.9 million veterans have registered for My Healthy Vet, and over 2 million veterans have used secure messaging to connect with their healthcare teams. Being the patient at a facility just down the street, which is also an academic institution whose portal never works, I am in awe of this accomplishment. Last year alone, there were more than 2.2 million instances of care through telehealth. That is amazing. We are the nation's leaders for sure. And VA's significant advancements in telehealth are being recognized on a national level and were literally highlighted by the President. Dr. Frisbee's colleagues are quick to praise her for her leadership and advocacy for a modernized approach to healthcare delivery, and recognize the critical role her knowledge, skills, and determination play in driving significant improvement in our digital tools, which allows us to help support veterans, caregivers, and VA healthcare teams. Unfortunately, Kathy could not be here today, but I did want to recognize her contributions to VA innovation. And now we would like to welcome to the stage a second finalist for the Robert Jessee Award for Excellence in Innovation, Dr. Beth Ripley. Dr. Ripley is both a manager of innovations and an innovator herself. As an innovation specialist at Puget Sound, she's managed more than 15 innovation projects and introduced frontline staff and patients to innovation through on-site fairs, walking rounds, innovation training events, and innovation competitions. For the past 4 years, she's worked to bring 3D printing healthcare solutions to veterans locally and nationally through the creation of an enterprise-wide 3D printing network. Her vision is to incorporate this technology into VHA with the goal of changing the way healthcare providers and patients understand and treat disease. As the leader of the 3D printing project, Dr. Ripley has overseen the growth of 3D printing from 3 hospitals to more than 20, and she'll be the first to tell you that's only the beginning. The 3D printing project has helped improve the care delivered to veterans by decreasing surgical times, helping to avoid unneeded surgeries, improving satisfaction with the informed consent conversation, and decreasing the number of hospital visits needed to access services such as orthotics. Her colleagues appreciate her innovative mindset and highlight insistently and repeatedly her ability to team build and foster collaboration, attributes that are vital to the success of her work. Congratulations, Dr. Ripley. Yes. we'll take a picture with Beth. And now, this year's Dr. Robert L. Jessee Award for Excellence in Innovation goes to an individual who has been described by colleagues as one of the most exceptional medical innovators, who leads, quote, by example and demonstrates commitment to a larger purpose. Without further ado, please allow me to introduce this year's winner, Dr. Tom Osborne. Congratulations.
Thank you very much.
In collaboration with the VHA Innovation Ecosystem, Dr. Osborne has established the National Center for Collaborative Healthcare Innovation. This trailblazing center will serve as a catalyst for the advancement of healthcare delivery and mission-driven innovation in the areas of oncology, heart disease, and mental health. The center will leverage the best that the private sector has to offer by collaborating with some of the most innovative Silicon Valley-based technology companies. In addition to the National Center for Collaborative Healthcare Innovation, Dr. Osborne has helped develop and implement innovative advanced technology solutions that improve care for veterans. One example is a cloud-based sensor solution that automatically monitors temperature and humidity for nearly 1,000 vital areas throughout the healthcare system and sends automatic alerts to designated staff to prevent loss of critical medication and other vital infrastructure. The solution he helped develop in advance is currently in use at both VA and Department of Defense facilities. Congratulations, Dr. Osborne, on your significant achievement, and thank you for your dedication and commitment to improving the care for our veterans. So we would now like to bring Dr. Ripley back to have all finalists on stage for a group picture. Is there an iPhone in the house?
Yes.
Now he's run out of juice.
Yeah.
Technical difficulties. So I'd like to congratulate and give a round of applause one last time to all of our award winners at this 2019 Innovation Experience. And now I give you back to Dr. Vega.
Well, that's it, ladies and gentlemen. We'll conclude the 2019 Innovation Experience. Our partners networking reception is going to begin immediately following this in this room. So please join us, come mingle. There'll be food and drink for everyone. We'll see you again next year. Thanks again for joining us.